So let's just go back and review. SB276 is the bill that Senator Pan introduced that it's supposed to take care of physicians writing fake medical exemptions. What it actually does is much, much more than that. It removes the physician being the one that has the final decision on the medical exemption and puts that in the hands of a state bureaucrat. It also curtails what medical exemptions can be written for. This bill, SB 276, will curtail that and will make it only CDC contraindications and precautions. Now, it was expanded in the last round of amendments that Senator Pan had to include the AAP and ACIP medical exemption criteria. And the interesting thing is, none of those three bodies have medical exemption criteria at this point. And so, what they do have is vaccination guidelines. So basically guidelines that doctors can follow to determine whether or not they should write a medical exemption, or whether or not they should vaccinate. Not that they should write a medical exemption, but that they should vaccinate. And so, but those are just guidelines, and ultimately it's up to the physician. And the CDC has said to us, we have emails documenting that this should just be a guideline for the doctor. The doctor is ultimately responsible whether he vaccinates the child or thinks it's appropriate or not. So the wording in the bill actually doesn't match anything. There are no medical exemption criteria, but if we go with the CDC guidelines for vaccination, then it restricts it completely. Things like having seizures after vaccines wouldn't be counted as a good enough reason not to vaccinate further. There are other things that are in the bill. There's a rule for review. So the medical professionals that write medical exemptions, if they write 5 or more medical exemptions, they will be put under review. Now, there's no definition of what that review is. There's nothing that says whether it is, your 5 medical exemptions that you've written that year are reviewed, and yep, you got checkpoints for all of them, you're good to go. You can write as many as you want after that, and that's the review. It doesn't say whether every medical exemption after that will be reviewed. It doesn't say whether all of the ones from previous, years will be reviewed. Doesn't say anything. So the doctors that are involved in this are really concerned with that, because they equate it to an audit. So, if you knew at point number 5, if you submitted the 5th thing to the IRS and you think you've done everything right, would you really submit that 5th thing if you knew it would trigger an audit? You wouldn't, because you wouldn't want to put yourself in that position. And the number 5 is this arbitrary number that doesn't associate itself with anything. A doctor could have 5 patients in his practice. A doctor could have 5,000 patients in their practice. Well, those are going to hopefully warrant different number of medical exemptions, because we already know that 2.6% of the population has vaccine reactions. That's according to the Harvard Lazarus study. The other place that triggers review is if a school is under 95% overall vaccination rate. Well, many, many schools are under 95%, but actually have 95% on all of the individual vaccines, because the way the overall rate is calculated is that it is, if you are missing one vaccine, then you're considered not vaccinated. So somebody could be missing a hepatitis booster shot, and they would not be considered vaccinated, and so that their number in the overall rate wouldn't be counted. What we've suggested is that they use the contagious diseases, so measles, mumps, rubella, chickenpox, and whooping cough. And if those numbers are below 95%, because realistically it doesn't matter if somebody's not vaccinated for hepatitis B in the classroom, that's not going to affect the other kids in the classroom, from a contagious disease standpoint. So that's the summary of the bill. There are many other issues with it, and if you go to avoiceforchoiceadvocacy.org/SB-276, you can see our full list of concerns with the bill. That's sort of the major overview, and I would say that it was heavily amended before the Health Committee and during the Health Committee, but it was amended to leave it that it is an extremely unfunctional bill. So if it does pass, if this bill were to pass as it is tomorrow, there's just no way that it would be able to be implemented effectively. They'll implement it. The other thing that I will say is that the regulations, so most bills, when a bill becomes statute, when a bill becomes law, you then go through the regulatory process. And what that is it's a public comment process where they sort of define the minutiae of the bill and go through, what does this actually mean? What are the restrictions? What are the criteria? What are the this and that? This bill, because Senator Pan wants to rush it through and rush it to get approved and out there, this bill actually in its wording says that we don't have to go, that this part of the statute will not go through the regulatory process. So he's taking out a whole administrative piece of it, which means that, if you're taking out an administrative piece, then you have to have what would have been in the administrative piece in the bill. You have to be extremely specific in the bill, and this bill is so unspecific. The bill has passed through the Senate, which is where it started, passed through the Assembly Health Committee. The next committee was the Assembly Appropriations Committee, where it was heard. And the Assembly Appropriations Committee, for any bill that is over $150,000, it goes into what's called the suspense file. The suspense file, it sits there, and all the bills that have monetary or budget over $150,000 go into this basically file that then on August 30th, all of the bills are reviewed and the budget that the Assembly has, only the number of bills that fall within that budget come out of suspense. So there's a bunch of bills that do not come out of suspense. But the bills that come out of suspense are within this budget. Once it comes out of suspense on August 30th, it will go, if it comes out of suspense. We assume it will because Lorena Gonzalez is the Assembly member. Lorena Gonzalez is the chair of the Appropriations Committee, and she is a co-author on this bill. So it's unlikely that it'll sit in suspense. There's a possibility that it may, but it's unlikely. If it comes out of suspense, we'll then go to the Assembly floor. The Assembly floor has 80 Assembly members that vote. We would need to get 40 votes. So Senator Pan needs 41 votes. We need 40 votes. We have 17 Republicans in the Assembly. We have probably another 5 Democrats that we're sure will vote no or abstain. And then there are a lot of undecideds. And those undecideds are people that either haven't voted on this issue before or are not, most of them are not willing to say where they stand on the bill at this point. If it were to pass the Assembly floor, it then goes to the Senate for what's called concurrence. Very few bills fail concurrence. I mean, it's very, very unusual that a bill stops at that point. Once it gets past the Senate, then it goes to the governor's desk, and it's up to the governor whether he signs it or not. And he has the whole month from the middle of September to the middle of October. He has a whole month to sign all the bills that get to his desk. On a Voice for Choice Advocacy, we have 3 documents that relate to the current version of the bill. So one of them is a list of questions and a list of amendments. So there's still a huge number of questions. You read through this bill, and we've gone through it line by line by line, just saying, what does this mean? Like, it's not defined. It's not defined. One part of it says that if the physician is found to be a public, it's not a public nuisance, but it basically is words to that effect. It's kind of like, what does that mean? What does it mean if they're accused of being a public nuisance? Like, what is that? And how do you become accused? And who's accusing you? What is the deal with this? And so there's a lot of things. So one document is that. Another document goes through our key issues. So I think there are about 10 to 13 key issues that we have identified with the bill. And we've gone through what the issues are, and then we've got suggested amendments to those issues. Now, some people are saying, well, we just want to kill the bill. We want to kill the bill, and we don't want amendments because this bill is bad. I agree completely. This bill is atrocious. We don't want this bill at all. But Senator Pan believes he has the votes, and I do think he does have the votes, to get this to pass without any amendments. So our request has been, and even some of the people that are a no vote, a Democrat no vote, have gone to him and said, look, there's issues with the bill. Like, we've got to make it a functional bill, that if it comes out, that it actually can work and not just prohibit every medical exemption on in California. And he has basically said, I don't need to. I don't need to have that conversation because I've got the votes. We are still pressing for amendments. It is a controversial topic, I would say. There are many people that are saying we want to just kill the bill. And I think for the summer, if that's the next 2 weeks, if that's the way you want to go into a legislative meeting, that's fine. What we've found in the past is, since 2015 in SB277, a Voice for Choice Advocacy has been working closely with a number of organizations. One of the organizations that we work a lot with is Educate Advocate. And what we found over the past 3-4 years is legislators are much more open if you go in and say, I have these issues with the bill, but these are the solutions. If you just go in and say, we want to kill the bill, they kind of turn off. They're kind of, unless they're already a no vote, they're kind of like, yeah, this is passing. Like, I have a political side of this that I need to consider. I need to consider my election. I need to consider what bills I have out there and who's going to vote on them. I have, a whole bunch of decisions that go into how they're going to vote on a bill. We've had really good success with bills in the past 3 years. There was a home visit. It started with a home visiting bill in 2017, which we were just like, we don't like home visiting. We don't want it to happen. And we went into the office initially and we're just like, we want to get rid of this bill. Like, we want to kill it. Not a good idea. And they were like, it's possible. It's moving forward. So then we came up with a really robust paragraph that basically said, you need to have this paragraph in documentation that's given to the parent that says that it is an they have to opt into this doing this home visiting. So they have to sign a statement saying, I'm opting into this, and I know that at any time I can opt out of it and there will be no ramifications to my CalWorks, which is what it was a part of. And so we got this paragraph, this amendment in, and it was amazing because it was like, okay, now we'll remove our opposition. We never supported the bill. They wanted us to support the bill because they had made the amendment. And we said, we'll never support the bill because it goes against our premise. We don't agree with home visiting to begin with, but at least this makes it workable because the parent is knowledgeable about what it is. And so we started off with that, and we've realized now that to get a legislative relationship, it is so much better because you want to work with them in the future. We're not, even if we kill this bill, there's going to be a bill next year. There's going to be a bill the year after and the year after and the year after. And if you're seen as somebody that is just, I want to kill the bill, it needs to be dead, I'm going to, hate on you if you don't vote no, that just doesn't work. And so we have this other document that we have is a list of all of the concerns, the major concerns that we have, and with it, what the amendments are that we're asking for. And I actually think that if we could get these amendments, we actually have a much stronger bill than even in 277. And the reason for that is that we would have the medical exemption. Two of the key points are, number one, that we have a medical exemption that is really robustly outlined what can be included, and we really want things like relevant research to be included in that. So it's no longer based on relevant standard of care, it's based on relevant research, and that can be research that came out yesterday. The other place that we want it to be clarified is the appeals process, and there's an act called the Knox-Keene Act, which is used for insurance. Basically, if your doctor says you should be prescribed this medication or this treatment, and your insurance company says, nope, we're not going to take that, we don't agree that should be, you can come forward with all of this documentation saying that, yes, this is why you should do it. And it includes the latest research and the latest, even things from conferences that can be included. And so we're asking for that wording, the exact wording, to be used in the appeals process for a medical exemption. And if we can get those two things, SB276 would actually be more robust than SB277 and would allow our doctors to practice medicine and to be able to give medical exemptions for the children that they believe have a detrimental risk to vaccines, and in a really robust way, and give them sort of the backup of being able to say, well, I used this journal article, this piece of research that just came out that said, this subgroup should not be given vaccines. So those are the two, I do believe that the amendment process, if this bill is to pass, which Senator Pan seems mighty convinced that it is, it has to be a better bill. It has to be better than this, and we have to request amendments. So your legislator is, if they're part of the Appropriations Committee, they should go to Lorena Gonzalez's office and say, we have concerns with this piece of the bill, I would like this amendment to be made. If he or she is not part of the Appropriations Committee, then you want to tell them to go to both Senator Pan's office as well as Assemblymember Aguilar-Curry's office. And Assemblymember Aguilar-Curry's office and her staff have specifically said, if we have issues with the bill, she's a co-author on it, but if we have issues on the bill, we should go to her office, or the legislators should go to her office as colleagues and say, these are the issues we have with the bill. What can be done about them? We have real concerns with this, this, and this. And they have said to us that they will absolutely look at them and consider them and go talk to Pan about them. Senator Pan has not been open to taking any conversations about amendments. When legislators have brought them up to him, he's basically said, we are, we have the votes and we're willing to, we don't need to take amendments.